today in Dr. Ozello's Sports Medicine Report is the thoracic spine. Now you may be asking yourself, what is the thoracic spine and why is he covering the thoracic spine? The thoracic spine is a midback. It's a huge area of our spine and it's often overlooked when we compare it to the neck and to the low back when we're talking about sports injuries. A strain of the thoracic spine muscles can be quite debilitating. It can keep you away from training, it can keep you away from competition, and it can prevent you from achieving your health and fitness goals. So these injuries are best prevented, and if they are not prevented, then there are specific strategies that you can use to recover from a thoracic spine sprain strain. There are two very distinct muscle groups in the thoracic spine. One is the Erector Spinae muscles. Those muscles run the entire length of the spine. They start in the sacrum, they go all the way through the low back, through the mid back, and some of them connect up into the neck and into the skull. What those muscles do is they allow us to straighten up and bend backwards. Those are long, thin, powerful muscles that must be kept healthy. The other group of muscles that often get overpowered are the muscles that pull the shoulder blades backwards. As a group, they are known as the scapular retractors. These are the rhomboid minor, the rhomboid major, and the middle head and the lower head of the trapezius muscles. These muscles work together to pull the shoulder blades backwards in what is called retraction, where the shoulder blades are pulled towards the spine and pulled towards each other. The symptoms of a muscle strain in the thoracic spine are similar to a muscle strain any place else in the body. You're going to have tightness, what we call hypertonicity. Those muscles become so tight that they're hypertonic, they're tighter than there should be. Pain. Pain can be very debilitating. It can limit your motions. Pain can be so great and the muscles can be so tight, what's called muscle guarding can occur. Muscle guarding prevents you from moving in positions that you want to move into, and it does that to protect the body. The body is protecting itself. So the muscle guarding can become very severe with a strain of the thoracic spine muscles. This can change your posture, this can change your movement patterns. Oftentimes I will see someone who is having a thoracic spine muscle strain. They may be bent forward, they may be bent to one side, their body may be shifted in several positions. Injuries to the thoracic spine can occur for several different reasons. It could be a traumatic type of an injury. It can be an injury where it is one specific episode that causes it, or it can be something that builds up over time through a repetitive trauma or through bad posture. What we want to do is look at each one of those. First of all, a traumatic injury. This can occur if you are playing a contact sport, or if you slip and fall during your training, or if you overdo it. These muscles can become very, very tight, and that is what we call the hypertonicity, what we just spoke about. Also, it can be through lifting. Say if you're lifting heavy, you're using bad form, you're fatigued, and you use bad technique on a repetition, those muscles can automatically tighten up, and it's a gripping feeling. It's a very, very painful sensation that occurs right away. If it is something that is a slow buildup over time, you start to feel a little bit, maybe it goes away some and then it builds back up. You start to feel a limit in your motion. You start to feel a little bit of weakness or a lack of endurance in those muscles, and it just gradually builds up. It has an insidious onset where it gradually builds up over time. So it can be a one-time specific incident that causes the thoracic spine muscles to be strained, or it can be a gradual buildup just through everyday activities or through training when you're not getting the proper rest, when you're not doing your proper recovery techniques. Contributing factors to any type of sports injury can be intrinsic and extrinsic. What that means is extrinsic means it's outside the body. It's something that we're doing that can contribute to the injury. Intrinsic means a source inside the body that is a contributing factor. An intrinsic factor for thoracic spine muscle strain can be several different things. First of all, it can be an impingement on a nerve. If there's an impingement on a nerve that goes to the muscles in the thoracic spine, it could be the scapular retractors like we talked about, could be the erector spinae muscles in the thoracic spine. The impingement on the nerve is not allowing the proper nerve signal coming from the brain going down the spinal cord, branching off the spinal nerve, going to the muscle. So the proper signal is not being sent and the proper signal is not being returned. So a nerve impingement is a contributing factor. Another contributing factor is weakness in the muscles that become injured. Weakness is a factor that can cause injury in any muscle, because what happens when we start to use that muscle, when the muscle starts to fatigue quicker than the muscles around it, it is going to be the weak link, and that's where the injury is going to occur. Other contributing factors can be weakness in the surrounding muscles. There can be weakness in the core muscles, in the lower spine muscles, in what we call the lumbar spine. If those muscles are not functioning properly, the muscles in the thoracic spine have to carry a bigger workload and they become injured. Also, something that can contribute to it is a strength imbalance. If the muscles in the front are stronger than the muscles in the back, it pulls our shoulder forward into a bad posture. Now I'm in an exaggerated bad posture where the shoulders are being pulled forward, but what this does is it stretches the scapular retractor muscles and it puts them in a weaker position where they can easily be injured. And the same thing can occur with the thoracic spinal muscles. If someone is very tight in the front and they're being pulled forward, such as this, the muscles in the thoracic spine are put in a weak position, and so they are being set up for injury. Extrinsic factors that can cause this. First of all, poor technique, poor training technique. When we're training, we always want to make sure that we use proper form. When you're fatigued, that is the most important time. Proper form is vital no matter what, but when we're fatigued, that's when you have to concentrate, focus on your technique so that your technique is perfect so you will not get injured. Also, overtraining. If you are not giving your body adequate rest between competitions and between training, you're setting yourself up for injury. Injury prevention is easier, faster, and less expensive than injury rehabilitation. Take the proper steps to prevent injuries. A strain to the thoracic spine muscles is no joke. It's a serious injury. So you want to do everything in your power to prevent this type of injury. As I mentioned before, overtraining is the main contributing factor. You want to make sure that you have a good routine and that you allow your body adequate rest between training sessions. Train hard, train smart, and use proper recovery techniques. That is the most important thing. Also, proper technique when you're lifting. That is going to help to prevent injuries. Ergonomics. We talk about ergonomics. When you think about ergonomics, you think about working, you think about proper lifting, you think about how you're sitting at the computer, but ergonomics is important in all walks of life. Ergonomics is important when we're driving a car, when we're sitting in the car. You want to make sure that you have your hands positioned properly, your shoulders positioned properly, your seat positioned properly. What I always recommend to people is don't hold the steering wheel way up here like this. 10 and 2 is not a good ergonomic position for your shoulders and your upper thoracic spine. Hold it at 3 and 9. That keeps the shoulders and the thoracic spine in a good position. Also, when you're on a computer, be in a good position. Take a break every few minutes. Get up, move your shoulder blades around. Oh, you're going to feel so good. Move around. Motion is the best medicine. When you're in a static position for too long, it is going to make those muscles extremely tight, even if you're in a good position. So you want to get up Every 15 to 20 minutes, stretch, move your neck around, move your shoulder around. Break can be as short as 10 to 15 seconds. And then sit back down in good posture and get back to work again. Then every hour, when you take a break, get up and walk around. Get the blood flowing in all those muscles. Move the spine, move the pelvis, move the neck, move the shoulders around. Get the blood flowing and drink plenty of water. Those are very basic tips, but they're going to help you a great deal to prevent an injury in the thoracic spine. Use good posture no matter what you're doing. Use good body positioning no matter what you're doing. Keep your spine straight. Keep your neck in line with your spine. It's going to help a great deal in preventing injuries in the thoracic spine. Do not hesitate to get professional treatment if you are injured. Prevention is key. If you become injured, no matter what happens, you want to seek some professional help. If you are not getting better, or your symptoms are getting worse, you're progressively getting worse, or you just don't feel right, go in and get an evaluation. If you have had a major contact type of an injury, you definitely want to go in and get evaluated. If the thoracic spine is so painful and so tight and tender that it is preventing you from training, that is preventing you from doing your daily activities, go to the doctor of chiropractic and get a professional evaluation. Chiropractic care will help a great deal. It is going to restore proper skeletal motion. It is going to optimize nerve flow. It'll allow those muscles in the thoracic spine to function properly. There's many things that you want to do, but do not hesitate to get proper professional care. Numerous strategies exist that you could apply to help to prevent and to recover from thoracic spine strain. Stretching, foam rolling, and strengthening exercises. I have several videos that I'm going to attach to a playlist that you can use and you can view, where there are exercises, there are stretches, there are strengthening exercises, there are foam rolling techniques that you can apply. These will help in the prevention and the recovery of a muscle strain in the thoracic spine. Use common sense. Check with your doctor. If you have not gotten professional help, check with the doctor to make sure that you can do these exercises, especially if you have had a prior injury to that area. You want to make sure that you do all the techniques correctly. What we're trying to achieve is we're trying to either prevent the injury, or if you have had the injury, you want to recover completely so that you can get back to your activity, you can compete and train at 100%, and you will not have a recurrence. If you have suffered this injury, a return to activity will depend on the severity of the injury and the progress that you make in your recovery. Any return to activity should be very gradual. You want to make sure that you start at the level that you are at. Don't try to start at the level that you're at before you were injured, or the level that you were at years ago. Start at your current level. Now, a thoracic spine strain, depending on the severity, shouldn't keep you out for too long. Obviously, if it's severe, it's going to keep you away from your training and competing for a long time. The time frame is different for everybody. But if it is a mild strain, it shouldn't keep you out of training for too long. Use common sense when you return. It's crazy that I even have to say that, but it's very basic because I've seen it so many times in my office where someone has an injury and they start to feel a little bit better, so they jump right back into their training. They don't have a gradual start, and they do too much too soon, and they end up making the injury worse because they have not completely recovered and they have not used common sense when they get back into their training. So the return to activity, it's individual depending on the injury and on the competitor. But all I ask and all I inform you to do is to use common sense, and when you get back to training, make sure that you are starting at the level that you are currently at. In conclusion, the thoracic spine, the mid-back, is extremely important. The thoracic spine is an area, like I said in the very beginning of the video, that is often overlooked when we compare it to the neck and we compare it to the lumbar spine. But injuries can occur in that area just like they can occur anyplace else. Prevention is key. Prevent an injury to this area by building a strong thoracic spine, building strong muscles in the entire spine, using good technique, building a strong core, and using common sense when you train. Make sure that you have a good routine, listen to your body, and recover from your training. Use strategies to help yourself to prevent these injuries. If you do have an injury, get professional help. Start your self-treatment immediately. Do your foam rolling, do your stretching, do your strengthening exercises. All these are going to help a great deal. Good luck with your training. Good luck in preventing the injury. And if you have had the injury, best of luck to you in recovering from this injury. Use common sense to get yourself back into the game. Train hard, train smart, and accomplish your goals. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Thank you for viewing this episode of Dr. Ozello's Sports Medicine Report.